All right, you guys want to see some fucked up stuff? Here we go. This is surgery. This is like legit surgery. This is a C-section. For those of you who don't know what this looks like. So if you need to like go vomit or something, go for it. Or you pass out, it's not my fault. You've been warned. This is chest bursting human style as posted in the title of the stream. You knew what you were getting into. Boom.
Previous scar. So I will get the incision on the previous scar.
Surgeons would be mad I called it a surgery. That's true. That's true. I'm sorry, Dr. Cheezel. I don't mean to offend you, sir. Is that suction? Yeah, that's a weird suction. This is, I think, in India or something, so their equipment is not quite what we use here. So for anyone who is unsure of what's going on here, this is a pregnant belly. That right there is a uterus with a baby in it, and they're cutting it open. And hopefully not cutting the baby open.
Probably baby's meconium is stand.
Do it. Do it.
You see, this is the membrane, bag of membrane. And yellow is
Uh-oh, here we go.
color. Probably. You have to make the incision at every level 10 centimeter. Yes.
What is this? Is this C-section?
I have already told you that
That is a hand. There we go. It's a baby! Look at that. The hand of life.
okay.
Hello, baby.
Yes, baby is crying.
That's the umbilical cord.
Baby is absolutely alright.
What's up, baby?
Now I'm handing over the baby.
There we go. Looks like something out of Aliens. That's why the title of the stream is Chest Bursting Human Style. That's exactly what it fucking looks like. We were all aliens once. Weird, cheesy, bloody aliens, yes.
I am.
Yes, indeed. Alright, so watch this. This is a good part. So speaking of aliens, you can't really see what's going on here, but he is pulling out the placenta. Oh yeah. Oh yeah, boom. Placenta. No, there's not another. There's just a big bag of blood.
You see, uterus is all right.
It does look like a second brain. It looks like a freaking alien, dude. If you just see it like sitting there, it looks like some like weird creature. That's a uterus. Ladies, that's what your uterus looks like. Well, actually it's not. It's what a pregnant uterus looks like. Yours is way smaller. Unless you're pregnant. Then that's what it looks like. It's a uterus. It's a uterus with a big hole in it. So there's... Oh, well, put his hand right in the way. Why'd they take it out? Because they have to close it up. And it's way easier to close it, and then they're gonna, like, kind of get all the placenta stuff out of there so it doesn't get infected.
Now I am...
It's like, infection in your uterus is a big problem. But yeah, it's way easier to close this incision if the uterus is out. But yeah, so... That's pretty much it. That's a C-section. They just close this up, and then close the hole in the person, and then you've got a baby, and you get to recover from abdominal surgery while you have a screaming infant. Yay! Yay! Can biological males get it? Are C-sections reserved for biological females? Well, I mean, you've got to have a uterus to have a C-section, so yeah, I'm gonna say it's females only. That's all you need to see. So that's a C-section. Now, why, you may ask, on Earth would you do something like this? And trans males, as long as you got a uterus that works, you can have a C-section. That's all I'm saying. You call yourself whatever you want to, but if you have a functional uterus, you have the ability to require a C-section. So yeah, C-sections are pretty commonly done. I think, let's see. Off the top of my head, the national C-section rate is something like 22%. That's what I'm thinking of. Primary C-section was 22%. So there you go. You can have them for any number of reasons, really. And just recently, actually, I believe ACOG approved patient election, like patient choice, as a reason to have a C-section. You want me to deliver the baby? Okay, that's a deal. Totally a deal. I've done it before. Still a bad idea. I'll get a baby hand to the face again. That has happened twice. It's actually baby hand to the mouth. Even worse. Nice baby cheese vagina juice in the mouth. So, reasons to have C-section. So, like I said, patient choice is now one of them, though, according to the American College of Gynecology, or ACOG from here on out. But that doesn't mean that every OB will actually let that happen. So, traditionally, C-sections have been reserved for, like, unforeseen circumstances. So it ranges from things where you're like, this baby's not really coming out, so we'll just do a C-section when it's convenient within the next like hour or two. Meh. Like either the patient's not like pushing very well, or they're just like getting tired, or whatever, or they're like their cervix isn't dilating. Who knows? That's kind of the like low end of reasons to do a C-section. And on the high end is like mom is dying, so you have to get the baby out pronto. And they like literally take you back into the operating room and splash like betadine or something, like some sterilizing agent on your body. They don't even like rub it on. They just like dump it on you. And like as anesthesia, you just put them to sleep as fast as possible and they slash baby out. And it takes like, it's fucking crazy. It takes like a minute. I mean, it's like literally 3 minutes before the baby's out. Like from patient in the room to baby's out. Like you put a breathing tube in the patient and say, okay, go. And the OB is just like going nuts and like cuts the baby out. It's nuts. It is really crazy. So yeah, everything from like, patient wants it to holy shit, this is an emergency sort of stuff can result in a C-section. And they're basically all done the same way. I mean, fast surgeons do these in like 45 minutes. It's like from in the room to out of the room is 45 minutes. I would say more typical is an hour. The question, at least from my standpoint, is how do you do anesthesia for these people? How do you keep them safe? So we kind of talked last time about spinals and how they work with the sassy dermatome man. Assuming there is time, you take these patients in and do what's called a spinal, which is basically, like most people have kind of heard of a labor epidural. A spinal is basically a one-shot, high-powered epidural. So you inject local anesthetic, which is, numbing medicine, in their spinal fluid, along with some pain meds for long-term pain control. And basically they get numb starting in like 10 seconds, but it takes like a couple minutes to like really set up, and basically they end up numb from like chest down. And so they're awake and they can feel people like pushing on them and stuff, but they don't feel any pain or temperature. And some people are like super distressed by that and like can't handle it, and so they earn themselves a breathing tube and a trip to sleep. But the vast majority of the time you just kind of like warn people that that's coming, and they're like, oh, okay. And they're like, oh shit, you weren't kidding, they are like literally sitting on my chest. I'm like, yes, they are literally sitting on your chest pushing your baby out. that is exactly what's happening right now. Yeah, so you do a spinal. Spinals pretty routinely tank people's blood pressure. So a lot of people like start to barf or feel like really lightheaded and just generally shitty. So you give them meds to raise their blood pressure, and that's pretty much it. And basically you give them a ton of fluids. Spinals lower your blood pressure because they knock out your sympathetic nerves, and that makes all of your blood vessels dilate. So you basically have a whole bunch more room in your blood vessels, and if you can fill that room up, then you're in good shape. And their pressure increases and everything's cool. Your mom had a C-section with you and said they were pulling your insides? Yeah, absolutely. There's actually a point where they actually like physically pull your rectus abdominis muscles apart. Like when they're opening, you will like see the obstetrician like grab one side of the rectus abdominis and just pull to separate them, because there's like a tendinous sheath between them. And so they just kind of like rip that sheath, basically. The part that's actually really scary about C-sections is when the baby is out. It's like you saw that getting the baby out is actually really quick. It's afterwards that you have to worry about. So The uterus is very, very, very vascular to begin with, and a pregnant uterus is like crazy ass vascular. As I recall, it gets like 15 to 20% of your overall blood flow, and by comparison, your brain gets a quarter. So like that's a lot of blood flow, and that's like a liter a minute basically. Ideally, what happens after you have a baby is your uterus clamps down. And there's drugs to do that, but there's also like that happens naturally. So if you have a patient who's like been in labor forever and they've been pushing for a really long time and they just like can't push their baby out, sometimes their uterus fatigues and it can't contract the way that it should, and you get a big floppy uterus. And big floppy uteruses bleed a lot, and that's not good. By a similar token, on the opposite end of the spectrum, if you have somebody who is like not in labor at all and their uterus just kind of decides it doesn't want to contract because it's like, hey, I'm still supposed to have a baby in me, I don't want to contract yet, that will also bleed. To fix that, you can get several different drugs. So you can get one called Hemabate, one called Methergin. The standard practice is to give people one called Pitocin, which a lot of people have probably heard of. That's the same one that they just sort of generally give you to induce contractions, like just during normal induction of labor. So we'll give you some Pitocin, like start you on a Pitocin drip, and if that doesn't work, then you get Methergin and Hemabate. And a lot of physicians will give some sort of med that gives like makes your uterus contract like actually inside your uterus. They'll just like put it there and then stitch your uterus closed. But if all of that doesn't work, you're sort of running out of options, right? So you can clamp the uterine arteries. You can actually physically squish the uterus and like pack it, put a bunch of like sponges and gauze and stuff in it to like hopefully help staunch the bleeding and like make it contract on its own. If you really need to, you can do a hysterectomy. That obviously is not ideal. Like most people who are having C-sections probably want to have another baby at some point. But yeah, so what we generally try to do with somebody who is like having true uterine atony is take them to interventional radiology, and they'll put like little balloons in their uterine arteries. So they like go in through your groin and fish a like tiny, occlusive balloon into your uterine artery and just blow it up so the uterus doesn't get any blood flow while it like decides to contract. And that I've never seen that not be successful. Like I've never seen a situation where we couldn't tamponade the bleeding long enough to get somebody there. But it is certainly possible that does not happen. Like if you're just like freely bleeding out your uterus, like I said, it's like a liter a minute, so you can bleed out very fast. And yeah, that's really fucking scary. When they can't get the bleeding like controlled at all, they're like, well, I guess we're cutting out this lady's uterus. You're like, no shit. Okay, here we go. Yeah, that is not a good time. What was the oldest patient that I had to deliver a baby for? I've delivered people in their mid to late 40s before. And yes, it is definitely riskier. So the older you get, the more likely you are to have, like your baby is to have genetic issues, for starters. And also, the more likely you are to have like placental problems. And that, my friends, is what's really fucking dangerous about giving birth. Why is that? Basically, as you age, your genes become less perfect, right? So you get mutations, you get your telomeres chopped off. And that's, for the same reason, that's why like cancer is kind of age-related, basically. So you just accumulate mutations and you're, more likely to pass those on to your kid. So placentas, those little bitches can be problems. There are different placental problems that you can have. Placenta previa is where the placenta is like partially over your cervix. Placenta accreta is when like kind of into the wall of your uterus, like it's actually like implanted into your uterus. Placenta increta is where it's in the muscular part of your uterus, so it's like actually growing into your uterus instead of just the wall of your uterus. And placenta percreta is when it goes through your uterus, so it actually implants like in the wall of your like abdomen or intestines or something. So that is real bad. Placenta percreta is really, really, really freaking bad. I have only seen 3 of these, 3 placenta previa, every single one of them got their blood volume replaced or more because they lost so much blood during their C-section. Yeah, placenta previa is massively dangerous. Really freaking scary. So you can very easily die from any of these. But yeah, placental problems are really freaking scary. And like sometimes with like placenta previa, the placenta can be like at the front of the uterus. And so, you know, when you saw that incision that they made in the C-section video, like if you cut into a placenta, it doesn't like that. And it gets back at you by bleeding everywhere. So, yeah, that shit is really scary. If they slice a placenta by accident, that's a huge problem. And don't forget that like a bleeding placenta means that baby is bleeding pretty like catastrophically as well, because all of the blood that comes out of that is not going to the baby, and in some cases might even be directly draining out of the baby. All right, well I probably ought to go to bed. You guys are fantastic. Thank you for coming out. Hopefully you enjoyed the C-section talk. That was fun. It was cool. It's one of those weird things that people don't really think a whole lot about. But anyway, I am Milkman Al. Thank you guys very much for watching. I will be back on Sunday at 8 p.m. Central, as per usual. Have a great night. Take it easy. I'll see you Sunday. Thanks again for watching.